And for more on President Biden's diagnosis and the treatment he's receiving, we are joined now by Dr. Timothy Quinn. He's the medical director at Quinn Healthcare. Doctor, thank you for being here.
Hey, thank you for having me.
And we can only assume that President Biden will be receiving the most advanced care available. Can you give us an idea of how his doctor is treating him now and also what the doctor will be looking out for going forward?
Well, right now, it seems that the treatment is right on course. He's receiving the Paxlovid. That's the new antiviral that's specific for coronavirus, and it's very effective. Mainly, his physician will be looking out for symptoms. And so far, his symptoms are very mild, which is a good sign. But because of his advanced age of 79, he'll be watched a little more closely than maybe somebody that's a little bit younger. But the fact that he's been vaccinated and boosted, that's definitely in his favor.
Well, and absolutely want to ask a follow-up on that. You know, it's not clear which COVID variant the president tested positive for. The CDC is saying the BA.5 variant is making up the majority of new infections now. And President Biden in his message was very clear this morning. He got both vaccines. He is double boosted. So what would you say to Americans who are maybe on the fence about getting their booster and they point to this and say, look, it didn't end up offering protection?
I advise all Americans, as I advise all of my patients, follow the science. Look at the data. And overwhelmingly, individuals that receive their vaccinations and their boosters, if they do contract coronavirus, which they can through a breakthrough infection, typically they fare much better. There's much less of a chance that they'll end up in the hospital and or losing their life. So getting vaccinated is the best thing you can possibly do.
We hear you. And can you tell us more about Paxlovid? We know it's made up of two parts, a medication that actually boosts levels of other antivirals, and then also a drug that inhibits the enzyme that viruses need to replicate. So many people who are testing positive right now, they want to get their hands on it. It can be really hard to come by. Why should only certain populations be using it? And is President Biden obviously in that group?
Right. Well, it's all about supply and demand. And right now, there's a very high demand with the coronavirus pandemic picking up so much. So what the medical community is trying to do is make sure that the people that need it the most get it. And those are the people that are typically more vulnerable. These are your individuals that are older, 65 and older. That's the most vulnerable age. And then those that have chronic medical conditions, especially lung conditions such as COPD, heart condition, kidney conditions. So what's being attempted is to try to allocate those medicines to that population first so that we can have the most effective defense against this coronavirus pandemic.
And in terms of it being effective for all of us, no matter what population you're in, if I can put you on the spot, Dr. Quinn, if you were to receive a positive diagnosis, would you seek out Paxlovid?
I would. I'm 49, but I'll be 50 years old next month. So I'm right there. But also because of my occupation, I'm a physician. I'm exposed to a lot of individuals that are vulnerable, a lot of senior citizens, a lot of people with chronic medical conditions. And I want to do everything I can to be as well as possible to care for them, but also getting those vaccinations, wearing those masks and all the mitigative measures so that I have less of a chance of contracting coronavirus, passing it on to my patients.
Absolutely. Dr. Timothy Quinn, thank you so much for speaking with us.
Thank you for having me.